The proper way to breathe is to use the diaphragm and the intercostal muscles, but the diaphragm is the main muscle of breathing. As you inhale, it comes down, thus forcing the stomach out. It provides a massage to the liver, the stomach, the entire mesentery, the entire second brain. This is the way that we should be breathing, with the diaphragm. That as it comes down, it takes in air and relaxes then we exhale. Now, people with post-traumatic stress disorder and other mental conditions can have difficulty with diaphragm breathing.
Take your right hand and place it on your chest. Your left hand will go over your belly button. When you breathe in through your nose, your belly's going to go out. As you breathe out, your belly's going to go in. Just make sure the hand over your chest isn't moving.
Problems with the diaphragm can lead to difficulty in breathing, difficulty sleeping, fatigue, pneumonia, and post-traumatic stress, other mental conditions can produce problems with the diaphragm. Thus, it produces problems with the gases, the oxygenation. The diaphragm is hooked to the brain. Mental conditions can affect it, but also problems in the phrenic nerve can produce problems and thus create a disturbance. The phrenic nerve will supply the diaphragm with the ability to move, producing a massage for the organs, helping to get oxygen properly deep into the lungs for complete mental awareness and body awareness. But problems with stress and problems with PTSD can produce a lock in the diaphragm. Watch. You see, stress and trauma can produce a problem with the breathing that produces a chest breathing. This also can then produce problems called hiatal hernia, where the diaphragm also becomes a problem. And the diaphragm is no longer able to massage the liver, the mesentery, etc. And this problem and a lack of the brain and the second brain then comes into effect, producing problems with the stress. Lama's class taught short chest breathing to block awareness of the pain. This was done for women who were pregnant so they could block the pain when they did childbirth. It also then blocked processing of the stress. So this could be used if you have pain, if you're going to have childbirth, but for normal people, this type of short chest breathing is a problem.
Breathing is called the pranayama, which means to extend the vital life force. Yogic breathing reduces stress, relieves anxiety, increases attention and focus, and even over time expands our lung capacity. We are going to learn the Ujjayi breath, or healing breath as it's known. Let's begin. For our Ujjayi breath, we want to sit in a comfortable cross-legged position, extending the spine, making room in our torso to expand our lungs. In the Ujjayi breath, we breathe in and out only through the nose. This cleanses the breath and heats the body.
This very simple technique of belly breathing will help to stabilize the nerves and assist us in processing our stress and also post-traumatic stress disorders.
Take your right hand and place it on your chest. Your left hand will go over your belly button. When you breathe in through your nose, your belly's going to go out. As you breathe out, your belly's going to go in. Just make sure the hand over your chest isn't moving. So let's practice. Breathing in, breathing out. Breathing in, breathing out. You can keep doing this 10 times for relaxation.